There is a steady but slow progress in curing patients with localized cancer, but most patients who die of cancer die of metastatic disease. For these patients, current treatments have the ability to prolong their lives but not cure their cancer. Therefore, we need a change of paradigm. We want to use the patient's own immune system to recognize and fight cancer cells. Radiotherapy causes tumor cell death, which releases tumor-associated antigens. These can be detected by the immune system to start an anti-tumor immune response. However, this is not enough to eliminate the cancer cells. This can be solved using immunocytokines, in which the IL-2 is coupled to an antibody L19, which specifically binds to a part of the fibronectin, EDB, present in the tumor vasculature. We have demonstrated that the combination of local radiotherapy delivered to the primary tumor, along with systemic immunotherapy, L19-IL2, activates a synergistic anti-tumor response, which results in a high percentage of tumor being cured. This anti-tumor effect appears to be dependent on EDB expression in the tumor, a biomarker which is easy to measure. When a mouse with 2 tumors is irradiated on only one tumor, remarkably, the non-irradiated one regresses as well. This is called abscopal effect. And when a mouse cured by this combination is re-injected with tumor cells, the tumor does not grow. The mouse is protected. This is called the memory effect. However, in the mouse which has not received any prior treatment, the tumor continues to grow. A phase 1 clinical trial has shown very promising results, whereby patients have suffered only mild toxicity, such as flu syndrome and transient tumor pain. So the next step is a multicentric randomized phase 2 clinical trial in lung cancer patients with a good general status and less than 10 metastases. The patients within the experimental arm will be treated with stereotactic radiotherapy and the immunocytokine L19-IL2. The trial will be complemented by an ambitious biomarker study before, during, and after therapy, including an analysis of neoepitope-directed T-cell reactivity using a unique DNA barcoded MHC multimer technology. We truly believe this combination has the potential to open a new paradigm in treating metastatic cancer with low toxicity.